Hey everybody, good evening. Welcome to I Care for Your Brain live on Facebook. We do a free lecture every Wednesday night at 6 o'clock. And the idea is to bring science-based brain health news and information directly to you from an objective source. My name is Dr. Karen Sullivan. I am a board-certified neuropsychologist. I have a practice in Pinehurst, North Carolina. And in addition to seeing patients in my practice, I really enjoy doing research to stay on top of clinical issues that are important to my patients and their family. And the last couple weeks, I've been doing something called an article review, and that's actually been really rewarding to me because it kind of carves out some time in my schedule to go down some research rabbit holes and do some investigation. Last time I was with you, we talked about a new diagnostic system for tremor that came out. An international task force got together, and they have a new subcategory within essential tremor called Essential Tremor Plus. And I had not heard of this before, and I thought, you know what, let me do a specific lecture that goes into ET Plus so I can have some time to look into it and I can share with you guys what I found. So what I did was a literature search, and what we're going to talk about tonight is what I found, where the field is at, how does this impact your care. What I found is that when this new classification system was applied in one study, that many people got reclassified as actually not having essential tremor as the way it used to be classified. So why I want to bring this information to you is that I want to empower you with this information so that way you can go to your movement disorder specialist, you can go to your neurologist, and you can prompt a conversation about how do you and your tremor disorder fit into this new classification, because it may mean a new treatment, a new understanding, a new route to better care. So if the physicians, if the neurologist and the neuropsychologist are talking about this, I want you to know exactly what is going on. So what I did was a literature search, and basically we look through academic scientific databases with a couple key terms. So I put in Essential Tremor Plus, and basically you see what comes up and you judge the goodness of the research, and you kind of decide, oh, this seems like it's legit, this seems like it was kind of industry based, we're going to ignore that one. So the first interesting thing that I found was the term Essential Tremor Plus does not show up in the literature until this year, 2018. And when I was with you last time, we talked about this article from a Dr. Bajada and his colleagues in a journal called Movement Disorders, and basically he was reviewing this new consensus statement. And what he talked about, if you remember, if you didn't see it, go back and take a listen. But what he talked about was that ET probably presented the greatest challenge to the members of this task force because they really couldn't come to an agreement about even keeping the name Essential Tremor. And really what this is all about is trying to move from a tremor disorder that is really not well understood and is very simplified. It's considered, even at this point, to be the most common movement disorder. And the way that we typically describe it is in very basic, simple terms that are only physical. So the way we talk about it, as many of you know, it's thought to be a monosymptomatic movement disorder that is related to it's a slowly progressive action tremor that is thought to happen in both of the extremities, typically the hands, but really without any other significant complaints and without a very clear etiology. And so what is really becoming apparent to me, and I think it's very positive, is that we are moving towards a more realistic, progressive understanding of ET, and that it's definitely not one thing. There are so many subtypes, and I think the challenge we have is, are these really subtypes of ET? Is this coming from the same source? Like there's one river and there's many different tributaries? Is it something that's actually not ET at all? Are we finally just realizing the non-motor symptoms of ET? There's just a lot that we need to sift through. So as you guys know, if you know about this consensus statement, what they really want to do is adopt a two-axis system. So the way they want to start classifying movement disorders is on axis 1, which is the clinical characteristics, and on axis 2, it's etiology. And what that means is what is causing it, what is the disease underneath. The new tremor classification as it relates to tremor has subdivided essential tremor basically into 3 categories as we have them now. So one is with or without involvement of any other tremor locations. So that would be if you have a bilateral tremor in your hands, do you also have a tremor in your head? Do you have a tremor in your neck? Is anything going on with your lower extremities? Then there's also without any other explaining symptoms or signs for the tremor. So making sure we're not really looking at an age-related tremor, it's not medication-related. And then of course we've got this ET+, which is what we're going to talk about tonight. And the way that the consensus group conceptualizes this as, quote, further neurological signs of unknown origin. So this is based on the recognition that there may be what they call soft signs that are not necessarily readily seen or tested at the time of diagnosis. And it's difficult because the panel of experts actually could not reach an agreement on what signs would be considered within the definition of ET+ or without it. But they did give some examples. So the 3 that they have listed are mild memory impairment, impaired tandem gait, and what this is when people walk and you put one foot right in front of the other, or subtle body posturing that is possibly dystonic. So this is kind of those fixed postures that people can get into. Sometimes people can call it a claw, where your hand or your foot, different parts of your body get caught in these kind of fixed postures. So this idea of a movement disorder having a plus placeholder is actually something that has happened in the Parkinson's world for a long time. The concern from the ET community is very justified. We are concerned that if we just develop this new diagnostic category of ET+, that instead of being a placeholder, it's going to be a bit of a grave marker, that we're just going to say, well, these people don't fit the ET category, they're over here in the land of plus. And basically, people are concerned that it's going to stop investigation, it's going to stop medical follow-up, academic, intellectual curiosity about what this is, and that is going to limit treatment for people and have people be misclassified. There's also concern that there are plenty of genetic tremor disorders that are very important to know because they are very dominant when passed down in the genes, different types of Fragile X issues, spinocerebellar ataxia, things like this. It's very important for someone to know if they're carrying those genes. So what's most important to some people out there is that we just don't want to have a false sense of security whether or not we decide this is ET+, and that kind of is the end of the road. So what they recommend is that indeterminate tremor syndrome might actually be a little bit more accurate. So that being said, going into the literature and looking up ET+, I want you to guess how many articles are out there on this topic right now. There's uno, dos, tres. We got 3. And I was able to track down 2. The third one is actually not a research paper, but it's kind of like a opinion piece, like an op-ed. And I couldn't track it down, and I emailed the author, but he is on sabbatical this year, and so he said he's not checking his email. But I want to tell you about the 2 that I was able to get a hold of. The first one is called Is Essential Tremor a Single Entity? And this is by a Dr. Hopfner, and he's at the Department of Neurology in a German university. So part of what he did in this article is, it also is not research based. It is kind of historical, it's informational, it gives you the history of the diagnostics on ET. It's really interesting. So he talked about how the term ET was first used in the 19th century and was finally established with criteria in 1949. But that we've always had, as I said before, this very basic, simple view that this is a slowly progressive action tremor, it's bilateral, there are no other complaints, there's no other issue. even by the end of the last century, the neurological literature really doesn't talk about any other symptoms. So you guys know, as a neuropsychologist, the things I'm most interested in are cognition and mood. So I wanted to know a little bit about the history of that. And much like many other things in the world of brain and behavior, boy, you can get yourself a lot of laughs if you start to look at this literature. So from 1960 to 1994, there were a series of studies that were done mostly at the Mayo Clinic, and they were just trying to look at the personality traits, the cognitive styles of people who had essential tremor. And there was one study that talked about 16% of folks with ET had something called psychoneurosis. So you can raise your hand if you're out there, you think you have psychoneurosis. I don't even know what that really means. Is that anxiety? Which anyone with a chronic health condition is, going to have some increased anxiety, particularly knowing about what the part of the brain that we think is most implicated in ET, which is the cerebellum. You're going to have some dysregulation of your mood. There was a study in 1990 that looked at folks with PD, Parkinson's disease, and folks with ET, and it said that they had similar personalities that were typically depressive, introverted, rigid, and lonely. Which I always feel so grateful when I look at that literature to see how far we've come, because that is just such bad science, and it's so misguided. So really the definition of ET has stayed pretty darn static up until the most recent past. Yet our knowledge of what the cerebellum does has actually grown in leaps and bounds. And so we know, and I've talked about this, and I'm really interested in the cerebellum, that there are so many non-motor symptoms that can come from cerebellar dysfunction. But yet it's like we haven't matched up the ET literature with what we know about the cerebellum. And it's kind of like I'm hoping that's where we're going and what this ET plus designation is really doing underneath the surface. So now what we understand about the brain, just in general, this is almost all parts of the brain except some very, very specialized parts, is that almost every part of the brain really works in triplicate, that it works in a physical system, it works in a cognitive system, and it works in a mood and behavior system. So this is very important for those of you with movement disorders because, and I often say this to my patients, you have to kind of think symbolically about symptoms. And so think about what you can see happening in the physical body and think about how would that map onto the cognitive system? How would that map onto the emotional system, right? So with ET, we have this tremor, right? We have an inability to start and stop movement in a smooth, coordinated way. So think, how does that match up with what we know about cognition? That to me feels like trouble with recall, trouble trying to start, right? Pulling things out of memory, and maybe also sometimes some trouble stopping, putting on the brakes, right? Having the best filter you can have. Emotionally, that's kind of like anxiety, right? You kind of can't control, rational dampening down of a fear. I know I'm worried, but I kind of can't put the brakes on. I can't really stop it. Other times people get depression and there's this feeling like I just can't, I intellectually care, but my behavior is just not showing that I'm motivated. So there could be kind of this coordination disconnect. And we're finally starting to get that, okay? But again, we're kind of not getting the word out to enough people, especially with ET, that these are real symptoms. These are neurological symptoms. You're not, of course you may be having some other issues. You've got every right to also have other disorders, mood disorders, psychiatric disorders. Your life could be falling apart. You can be completely broke. Those can give you real symptoms, but I worry that there's people out there who are having genuine ET related symptoms and they're just not getting validated because people don't understand what the cerebellum does. And so finally there was a study that actually looked at folks with ET, people without it, and these subtle abnormalities were finally validated. And what they found was that there is a mild disturbance in that tandem gait, putting one foot in front of the other, some subclinical akiomotor disturbances, meaning coordination of the eyes, a mild extremity dysmetria, meaning that when you go to reach for something, right when you're about to get to it, your hand gets a little bit off balance, and disturbances of timing. And if you know what the cerebellum does, that makes perfect sense because it's the great coordinator of everything, not just resulting in a tremor. If that stuff appeals to you, watch some of my old lectures because we really got into that. So the authors in this paper paper really like the new classifications. They say it's a better foundation. Right now we think of ET as much too uniform, and they kind of conclude by saying it's an exciting time in neuroscience. The second article is actually the only research-based article that I could find in my literature search that actually took data and is making an interpretation. So this is out of the University of Toronto. It's in the Journal of Parkinsonianism and Related Disorders, and it's called Essential Tremor Plus is More Common Than Essential Tremor: Insights from the Reclassification of a Cohort of Patients with Lower Limb Tremor. So what they did is they took the new tremor criteria, and they had a group of patients that were seen previously and were in a research database, and they had all sorts of information about when it started, how bad it was, how did it move in the body, what were their other symptoms. And they basically took these folks and classified them two ways, the old way and the new way. And there was 283 people in this study, and they were ranging in age from 65 plus or minus 16 years on each side. About 60% were men, 40% were women, and the tremor duration is wide. So anywhere from 25 years of having a tremor, give or take about 18 years on each side. So that's a big, old, wide spectrum. 124 people were reclassified as having something other than classical essential tremor based on the new classification system. Most of them, the majority of 133 patients who were previously diagnosed with ET, only 15% of them continued to fulfill the ET criteria once the new criteria was applied. 110 of these people were reclassified as having ET+. Really interesting. So what I wanted to do is tell you what were the criteria that made people flip over into ET+. So I'm going to go through a bunch of numbers here, and I want you to be paying attention and even writing down, documenting if this relates to you, because this is one of my take-home messages, is talking to your provider about how does this relate to your disorder, your care. Okay, so remember, the way ET used to be classified is slowly progressive, bilateral action tremor, right? No other signs. So 97 people in this group of 283 were found to have a resting tremor. Okay, so remember, an action tremor and a resting tremor are different, of course, and they go by their name, right? So a resting tremor we commonly think of with Parkinson's disease, and it's when someone's hand is at rest. You can kind of see that it moves like that. An action tremor is when the hand goes, or the body part goes into action, and it's reaching for something, right? So this makes brushing your teeth hard with ET, doing buttons, writing, anything where you're actually focusing in, and that's because that's what the cerebellum does, right? So 97 of these people actually were found to also have a resting tremor. 20 of them were found to have that tandem gait impairment. 14 of them were found to have memory impairment. 8 were found to have gait ataxia. And so this is kind of an unsteady, staggering gait. Walking is uncoordinated. We kind of think of it as not ordered walking, okay? 5 of the people had signs of neuropathy. I'm not sure how that fits in. 5 of them had questionable dystonic posturing. Okay, so remember that's kind of a twisted or a fixed posture. 5 were found to have rigidity. 2 were found to have reduced arm swing, right? So when they walk, their arms don't go contralateral to their legs. 2 were found to have impaired mirror movements, and I did not know what this was, so I knew you'd be curious. And so basically, it's really interesting. So you do one thing with one hand voluntarily. So let's just say you decided to stick out each finger at a time. You know, usually you can suppress what the other hand is doing. In mirror movement impairment, the other hand, even though this is under voluntary control, the other hand involuntarily starts doing the same thing. So that's really interesting. And one person had bradykinesia, which is just a slowness of movement. One person had myoclonus, which is an involuntary rhythmic kind of muscular contraction and relaxation. One person had ankle clonus, and one person had oral dyskinesia, which is just kind of a little bit of a movement around the mouth. So in these people that went over to be an ET, we wanted to know more about them, right? So as a whole, these people are older. The people that they think now really have ET plus are older at the time their tremor started. So the folks that went on to have ET plus were anywhere from 18 to 58 years old, and the folks that did not have it were anywhere from 16 to 46. That research isn't hugely compelling to me. I mean, if you told me people who were under the age of 25 when they didn't have ET plus, and people who were 45 and older, that would be a little bit more impressive to me. So the difference between 16 and 18 doesn't feel that big. The difference between 46 and 58, not necessarily that big, but when you start to look at t-tests and statistics, and it's so new and people are dying for information, these things kind of make headlines, but I'm not sure I really care too much about that. The folks who had ET plus with the resting tremor were significantly older than the other ET plus folks. Again, I'm not really buying a huge difference between those ages. And the ET plus folks had a longer disease duration. So I think the thing that stands out to me is because what we call standard deviation is so huge. So like the mean, the average age is 36.8 in people who had it. But then the standard deviation is 18.9. So you have to add 18.9 years on either side, right? So once you start to think about that range, to me, what stands out is just how different people are with ET. Even within this research project where we're trying so hard to group people together and figure out patterns, it's all over the place. So we got to talk about conclusions and what all this means, right? The authors talked in the paper about how they face challenges when applying the ET plus criteria. There's no clear boundaries to define what are these soft signs that we're looking for. They talk, and this was what I was really hoping for, they go into saying, hey, this is all just cerebellar stuff. Are we just finally validating that a lot of this stuff is just happening because there's dysfunction in the cerebellar system? They also talk about, maybe just getting older. Also, age-related tremor is also a thing. Also memory impairment. Are we just really looking at ET plus normal brain aging on top of ET? They really did bring up some very important points. They also talked about, maybe because resting tremor was so common, maybe that's just part of having ET over time, is that you go from having an action tremor more to a resting tremor. Or maybe we have called these people ET, but really they're actually a whole nother movement disorder that we just really haven't labeled yet. So in conclusion, they say that their study shows that ET, at least in its pure classical defined form, that was once believed to be the most common tremor disorder, is in fact a much rarer entity when you use the new criteria. And they really make the point that this new ET plus group is also very varied, that we really aren't seeing huge patterns. Okay, then that third article was from a Dr. Elon Lewis, and I believe he's up at Yale, and he just wrote a response. But like I said, I emailed him and he was on sabbatical, and it's not a freely available journal article that's out there. If you were with me last time, you know that I posted these articles for you because I like you to have them to read yourself. I cannot do that this time because last time, the articles that I referenced were free access, meaning that anyone can get them. If I posted them here, I could actually be accused of copyright infringement. However, what you could do is find someone with an academic affiliation and ask them to kindly download the article for you and send it to you through email. But really, I'm giving you the very I basically am summarizing these for you, so I think you could write some of this stuff down, and at the end I'm going to talk to you about how to apply what I'm talking about tonight. So what are we going to do with all this information? How does this apply to you? I hope you, if you've been watching me, you know that I strive to be a very practical provider. I want things to have meaning in real life. I believe in the value of intellectual pursuit and academic curiosity, but at the end of the day, if it doesn't impact care, if it doesn't help people, doesn't really matter that much to me. So I think based on this information, it is reasonable to, at your next movement disorder neurology appointment, to ask them, maybe should we revisit this diagnosis? Ask them if they know about the task force's new criteria. Bring up the University of Toronto paper where all of those folks were reclassified. I would be curious about the response that you get. To me, a movement disorders doctor should be on top of this. you know, people should be interested in this. The idea should not be, you know, you come in and they want you in a nice, neat little package. Doctors shouldn't want to be right. They should want to get it right. So this could be a little litmus test. If you don't feel like you get great feedback, or you get dismissed, or somehow there's this idea like they should know the most about the research, if you can, you know, maybe it's time to move on. I want you to really, as always, focus on your symptoms and document them and share them. I want you to think about this concept of ET+. And here's the thing, I want you guys to comment down below from this lecture and tell me, people actually living with ET, what do you think of this? You know, I'm over here with my empathy extenders and I'm trying to digest all this information, but what I really care about is, what do you all think? Do you think plus is a legit category? Do you think this is just a first pass explanation of a still largely misunderstood movement disorder? That's kind of what I'm thinking. So really, in conclusion, what do we know now? The field is really a little bit more clear about what's going on. This is positive. We are moving towards appreciating more complexity within brain health challenges. This is going to result in better care, more specialized research, personalized brain health care, which is what we so desperately need. Remember that idea of most parts of the brain working in triplicate. I think that that is really important, and you know, maybe I should even do a talk about that one day, because there's a lot of validation there, because the field, remember what I said before, we have a disconnect between clinical disorders and what we know about parts of the brain that are implicated in those clinical disorders. So sometimes we advocates, people who are living with it, people who care about people who are living with it, have to do the work and do some connect the dots. So that could be an interesting topic for us to talk about in the future. But really, I am just, you know, I'm on the outside here trying to look in, trying to understand. If you have ET and you feel comfortable chiming in down below, please tell me what your opinions are of this new diagnostic category. It's really interesting. I think it's high time that we started to appreciate this is not a monosymptomatic disorder at all. There's so much more that goes on, and at least this is one step towards a little bit better understanding. Thank you guys so much. I actually had a really fun time researching this one. It's not often that you get to have a new category within the world of brain science. If you guys thought that this was helpful, or if it makes you think a little bit more deeply, I'd love and appreciate for you to share it, especially on any ET support groups. It's most important to me that this information empower people and educate people so they can fight for the very best care that they deserve so badly. Thank you guys so much, and I'll see you next Wednesday. Bye-bye.